Hey everybody, this is a quick video tonight. I just want to do a little bit of ASMR and maybe I'll talk a little bit about mental health in general. I know that there are some people that love my Kindle cover. This is from Oberon Designs out in California. So I used to live very close to the place where they make these. Oberon Designs. They do purses, Kindle covers, phone covers, things like that. This is like the third or fourth one I've had because I have a tendency to lose Kindles, unfortunately. I lost one at the Polynesian Cultural Center in Hawaii. I can't remember what it looked like. I think it was green. So if you found it, I hope you enjoyed it. That was like 6 years ago. So anyway, I'm just going to do a little ramble about some of the things I've been thinking about today. So I think most of you that have been following me know that I'm a psychotherapist, and sometimes I talk about mental health. I did a soft-spoken video recently, and it was really hard for me not to whisper, so I'm going to just go ahead and whisper away on this one. So, I've always been interested in psychotherapy and psychology since I was probably 20 years old in the Air Force. And someone asked in a video if I liked being in the Air Force, and the answer was yes. I was a medic, and I also worked for a little while in a psychiatric clinic in the Air Force Hospital. That was my first experience with counseling or mental health, and to me, it was just as rewarding as being an emergency room technician, riding on an ambulance. I think in a lot of ways, counseling and psychotherapy is one of those things that people that get into the field are drawn to it for a lot of reasons, but I think one is trying to understand themselves, and the other one is trying to help people and maybe help themselves at the same time. So, I feel like anyone who is alive can probably benefit from some form of therapy, or just being able to talk to another person about what they're feeling the things my instructors always talked about when I was in school was experiment, find what works for you, like what you feel comfortable doing. Because therapy is not a one-size-fits-all thing, and just because one therapist is not speaking to you in a way that you connect with, you can find a second one or a third one. And people will come in and out of therapy at various times for various reasons or problems. So again, I've practiced more of a depth psychology at times, and I've also done rational emotive behavior therapy and cognitive behavior therapy. So those are very popular with insurance companies because they have a shorter time to get someone to solve a problem. But I think that the therapy that I feel most drawn to is psychodynamic and a depth psychology, where you're maybe not trying to solve a specific problem, but you're helping the person grow, and you're helping the client find their own answers and understand themselves. So to me, that's the one that I like the most. However, there are times when a CBT approach or an REBT approach is what the person needs. They have a short time to solve a specific problem. So I like the fact that I keep learning different things. And I like the fact that I can adapt my treatment to an individual person. So Irvin Yalom, who wrote a very famous book about group therapy, it's still the gold standard for therapy groups. Irvin, he practiced more of a depth approach. And one of the things he talked about was creating a new therapy for every client. And I like that idea. So, if you're in a situation where you feel like you need some help, some guidance, don't be afraid to look into therapy, and then also to find the therapist who you connect with, because it's not the same for anyone. People have different approaches and different styles. And a therapist may fit for you at one point in your life, but perhaps a different issue comes up. But I think everyone can benefit from having someone to talk to, someone to work through their problems with, where they may not be able to talk to people in their life. They have that other voice, that other ear to listen to their problems. So again, don't be afraid to go out there and find what's right for you in therapy, and to unburden your soul a little bit, if you like that term. They talk about